May 24th, 2023. You guessed it. Hit that subscribe button if you haven't. Most of you's not. So, well, y'all that watched the video yesterday, about the drug test, we finally got an answer today. I called this morning after I calmed down, talked to them rationally, and about an hour ago they called me back and told me that that was impossible, that if you're taking that much medicine, it should show up in your urine. They would not do a blood test. I offered to do hair sample, saliva, whatever they wanted. They refused to do it. Said the doctor said that he's never heard of anybody showing up negative on a drug test. I asked him, did you specifically test for the oxycodone? He said, we run a standard drug test that was sent to the lab, and I informed him that it was a synthetic, that I've had this problem before. He said that doesn't happen, and that he was not going to treat me anymore, that basically I had dealt with my diabetes for, since my doctor died, and just not, pretty much you're on your own. He's not going to refer me to the surgeon. I said, you told me I needed surgery. He said, you do, but I am not going to put my name on your file and refer you. So, with that said, as of right now, May 24th, 2023, we talk about the fall of America all the time, right? The fall of the world, SHTF happening. Well, as of this day, I'm stopping all medication. I'm stopping the sugar medicine. I'm stopping it all. We're gonna let it do what it's gonna do. Some of you are gonna be like, that's not right. Don't do that. But that's what we're doing. That's my decision. You finally get where you go ask a doctor for help, try to figure out what's wrong. They figure out what's wrong, and then they accuse you of lying, even though multiple witnesses are standing there telling them, no, he takes his medicine every day. He takes it religiously every day. I don't like taking it, but I do take it. And they call you a liar. I told them that. I said, I don't like being called a liar. This is like, he said, I'm not calling you a liar. I'm just telling you what it said. I said, so you're not willing to do another test? He said, no, I'm not. I'm done. You're done with my office. So we're going to see how long it takes the diabetes to get you right. Now, I don't eat much sugar or nothing like that. And if you've been watching my videos over the past, y'all understand that even with no sugar, my sugar for some reason is staying above 10 and 11 on an A1C. I don't eat sugar. I was pretty active up until my back acted up, and it's put me down for about, 3 months almost now, 2.5, 3 months. So we're going to see what happens to that. I really wanted to get my back fixed. I really did. I sat and I thought about it and thought about it. My last surgery, it took 18 months to get back to about 80% of what I was before. And we were debating on doing the surgery or not. And I finally said, I need to go ahead and do it. I'm 46. It's bothering me this bad right now that I don't know how it's going to be when I'm 56 or 66 or 76, right? I don't want these problems when I'm that old. So I decided I was going to go ahead and do the surgery, the neck, the mid back, and the low back surgery. But sometimes things happen for a reason, right? Maybe the reason why I'm not able to get to the surgeon because I called the UAB, which is a big hospital in Birmingham, just a few minutes ago, and they said they still have not got the referral. I explained to them what happened and what was going on. They said without a referral we can't see you. So, and to give you a little rundown exactly of what my back is doing, I've had spinal fusion. I've had a surgery where they went in and cut disc out. Then I had a spinal fusion, and I've had several epidurals in my back. What's going on now is, now I have herniated disc in my neck, mid back, and low back. What's going on now is I'm having problems with my bowels and my bladder. I'm not going to go into graphic detail on that, but some of y'all may understand what I'm saying. I have numbness in both my legs. My big toe on my left foot is completely numb. I mean, you can do whatever you want to it and you couldn't feel it. But the massage things, the guns, we put that on my back in a certain spot, then I can feel my toe again. So that's kind of strange, ain't it? But I have MRI done. I have severe spinal stenosis. A lot of people have that. I understand that. Above my hardware. One section above my hardware. They're wanting to extend that hardware. I've also got problems in my mid back, which is affecting my upper abdomen, causing pain in my sides and across your stomach. Like The best way to explain it's like something squeezing you all the time, right? The neck issues, when I lay a certain way, it's hard to breathe. It's like somebody sitting on your chest. You know, what's upset me about this whole thing is, I'm still diabetic. I still, probably need treatment for that, right? I've heard of change your diet. I've changed my diet, but yet I'm still diabetic. I don't consume no sugar. I do consume some carbs, not a lot, but I can't get my sugar down, and I don't know what's going on with that. The pain stuff, you can deal with it. It might put you down for a day, and you're gonna lay there and you're gonna wish, oh my God, And when he gave me the medication, I didn't really want to take the medication because I knew something like this was happening, because this has happened before, right? I never got kicked out of a doctor's office for it, but I don't know why my body will not produce it in my urine. I don't. I wish right now. Like I told him, I said, I'll come down there right now, take it in front of you, take the drug test, and it'll prove to you. That don't happen. That don't happen. When my workman's comp stuff was going on, we had the same issue happen. They was sending me to pain management in Huntsville. Only thing that was showing up on that was Valium, which they were giving to me for muscle relaxation. I never understood that, but I was on oxycodone, not Percocet. I was on 20 milligram oxycodone before this surgery because the company made me go to pain management first, right? It didn't show up in my urine over. I called my lawyer because there was a lawyer involved in this at that time. He said, all right, the next time they do this, I want you to call me. So they called me like 3 o'clock on a Wednesday afternoon and said, we need you over here Thursday morning by 10 o'clock. Do your drug test. You're in pain management. They're going to drug test you and count your medicine, right? Well, I called him. He said, all right. He said, I'm going to send you to a place down there in your local town, which everybody knew this place because that's where all the companies used for drug testing, right? When I went in, now I took 2 of my pills that morning. So let's say I got up at 5 o'clock. I was down at that place at 7:30, done my drug test, left, went straight to Huntsville, did my drug test there, and it didn't show up. Well, the drug test I had done at this other place in my local town, they sent it off. And when they sent it off, they specifically tested for that medication in it, and it showed up. Well, I explained this to the doctor today. I even told him, I said, you can go back because this stuff all went to court, right? I said, you can go back. I give you permission to look at my stuff and you'll see what's going on. He's like, I don't care. I don't care. I'm like, my exact words to him, what the hell, man? Number one, I didn't sign up for no pain management. When I was talking to you, you read my MRI reports. You said, I'm going to give you something here until we get you to Birmingham to help you till you get there because you need it. I'm like, okay, whatever, And 2 weeks later, they drug test me. And I took my medicine religiously 5 times a day, 50 milligrams a day, and it did not show up in my urine. What I'm upset about is he didn't call me. He didn't say, hey, we got a problem. I didn't hear from him. And he kicked me out of the practice. I'm like, what the heck? Why are you kicking me out? Just, if it's not showing up and you got that big of an issue with it, just don't prescribe it. I told him, I said, I don't even want the damn medicine because it's not helping. It is not, I'm not 20 years old out here popping a pill to go party on Friday night at the club. I take 1 in the morning, 1 at lunch, 1 in the evening, and 2 to go to bed. That's what I took. I said, and it's not making my day better. I'm not taking a pill and going out here and picking up logs and moving them around. I'm still getting around real slow and it still hurts. We had even discussed, me and my girlfriend discussed that, hey, you need to tell him, this for the drug test, that this medicine ain't really helping you. See what he says, what he wants to do. The problem that causes all this issue at doctor's offices now when it comes to pain management is people that do not need pain medication are getting the pain medication. They're selling it. They're eating the hell out of it. They're getting 100 a month and 2 weeks later they're gone. My pill count was right on count too when we got down there. I got 120 and when I got down there I had 58 pills, which puts me right in the ballpark. I was supposed to take them every 4 to 6 hours. It's almost like, I told him, I said, it's almost like because I'm a cash patient that I'm paying cash and don't have insurance, and you can't order all these fancy tests that all doctors order that you really don't need, that you're kicking me out because of that. I said, I could care less about this medication because, number one, it's not helping. Number two, I had sat there and talked to this doctor the first time I went in there. I explained to him how I didn't trust doctors, how, I don't want to be ran around. Just shoot me straight, talk to me straight, don't BS me, because I don't trust them. At the end of the day, you should be able to trust your physician. You should be able to trust them wholeheartedly. If they tell you something, the catch to this is they have to trust their patients too. Now I have no doctor, and he's not willing to refer me to another doctor. He pretty much told me since now that he called it flagged. He said, now on your record it's showing that we kicked you out but due to not urinating or not having your medication, your pain medication in your system. And I'm like, okay, what's that mean? He said, more than likely you won't never get any more medicine like this. I'm like, okay, well, it's not working. The whole goal here was to get me into surgery and to get this fixed, right? Not to take medication for the rest of my life that is not fixing the problem I have. I don't need something to mask the problem, right? I need some way to fix the problem. And I don't think doctors understand that anymore, that, hey, I'm not down here to get medication to make me feel better and not fix what's wrong with me. That's the problem today. They want to just keep you there. We're going to give you this medicine to counteract that medicine, or this medicine for this, but yet never fix the problem that is causing these issues, right? The MRI clearly shows what I need done on it. I do not want another back surgery. Don't think I want another surgery. But I'm at the point right now where this has got to get fixed. It's why we were going to these doctors, right? It's got to get fixed. But today, when this happened, I'm kind of like, hell with it, right? Right. I firmly believe that when we're born, we have a time to die. We don't know what time that is. We don't know the date, time, nor place, right? It's going to happen one way or the other. If you fall over dead tomorrow, it was your time to die. That's the way I look at it. Some people may say, no, that's not right. But that's the way I look at it. So as of right now, May 24th, 2023, we are cutting out the sugar medicine because, number one, what good's it going to do me to take it for another month and a half and then not have sugar medicine? Right? What's the point of that? I don't know how to reverse this diabetes. I've tried everything. I've tried the apple cider vinegar. I've done all this. I lost a lot of weight. I weigh roughly, let's call it 200 pounds. I fluctuate between 195 and 210. I lost a lot of weight. I used to weigh 300 pounds after my surgery. You have a major back surgery, you balloon up, right? You get big. Not big, but you get fat and lazy pretty much, right? And I lost weight. And doctors telling me, oh, we can get your sugar under control if you just lose weight, quit eating sweets or this and that. I did that. Guess what? My sugar is sky high. And I've told you before, when it comes to the diabetes, I'm type 2. I'm not insulin dependent. I believe that's what it's called, where I have to take a shot, which technically I probably should be on a shot because of the way my sugar is. With medication, it's still not coming down. It's hovering between 10 and 12 is what they told me last time they checked it. So with prepping and diabetes, it's hard, right? Especially if you're insulin dependent, because you have to have a way to keep that insulin cool. And I've always told myself I will never go on a shot. No matter how bad it gets, I will not take an insulin shot because I don't want to be dependent on a shot. Simply, and another reason is if you don't have insurance, you can't afford the insulin. Even if you have insurance, the insulin is still sky high from what I'm hearing. But I'm not doing it no more. No more medication. I used to treat my symptoms as far as my back pain. When it would flare up, I would treat it with kratom. In Alabama, guess what? Kratom become illegal, right? You can't get it no more. It's illegal. It's a felony if you have it. They classify it as same as if you have heroin or anything else on you. It is considered a felony. So, did that for a while. And then in 2 or 3 years, I was kind of, I'm just not going to take nothing no more. Of course, it got worse, worse, and worse. And then all of a sudden, it just, right, I'm like, oh my God, it's bad. So we start lining stuff up to get to doctors, and I'm right back where I started. Please, I'm not asking you to go back to look at these videos for views. Go back and look at the videos about when I first went to my doctor, my personal doctor, from last September, October, somewhere around there. Please watch it. And we discussed a lot of this then, and look where we're at now, and I was right. I hate being right. I hate it. I can't stand it. A lot of people are like, I was right. I don't like being right. I do not like being right. To the people that commented on that video about the drug test, thank you. I was mentioning, I can't pronounce your name, Matrisna or something like that, and I'm sorry if I'm pronouncing it wrong. That article you sent, I read it, and I was like, that kind of makes sense, right? Well, I also emailed my lawyer that handled my workman's comp case last night and explained to him what had happened at the doctor's office, and he said it happened again, didn't it? I said, yes. And we got talking about this and that. He's telling him you'll do this, and I did everything he said, right? Now he's mentioning a thing called patient abandonment. I don't know what that is, but it's some kind of legal term, right? It's something to do where I guess the doctor just gets rid of you even though you need medical care, right? I'm not interested in that. I'm not. This is why, I've had a hard time trusting doctors since my family doctor that I had for 10 or 15 years died. He just died all of a sudden. The man caught cancer. He never dipped, smoked, drank, or nothing, and caught mouse cancer and died. To me, that still bothers me to this day that, I've dipped pretty much my whole life, and that man, how does he catch it, right? How does he get that? And that bothers me to think about things like that, but I don't know, guys. If you have a health problem, I am not telling you not to go to a doctor. I'm not saying that. From my own personal thing, I'm done with them. I've said this before in videos, y'all know this, but today is the final nail in the coffin. What are you supposed to do? You do everything you're told to do. You do it by the book. You get called a liar and get kicked out. And you can't defend yourself. You're not. It's like they're God, right? My word goes. It's me. What I say is it. And I asked him, I said, what are we supposed to do about this back surgery? And he pretty much said, that's not my problem anymore. It's a good thing that we talked over the phone and not face to face. People that knows me knows I have a temper, a really bad temper. I haven't had a temper in several years, but I could feel that old me creeping back up on me, right? I could feel it. I don't like that person. I try to avoid being that person nowadays. I haven't been that person for several years, but I could feel it coming back up, and it was great that we were talking on the phone and not person to person. I can't believe how the medical field is right now. I'm not on here asking for your pity. I'm not on here to make you feel sorry for me. I look at all y'all as family. I tell you what's going on in my life. And like it or not, that's the way I am. That some people tell me I tell people too much stuff. That I should keep stuff to myself. But I'm sure somebody out there is going through 100 times worse than what I am. And I feel for you. I'm not one of the people that, I feel for you. I really do. I understand what you're going through. Because ever since the 2020 started, you can see what's happened to the medical field. And it's been going on for a while. Been going on for a long while. But guys, we're going to keep making videos, and we're going to hopefully not be witnessing the fall of Boss Prepping, as the months go by, from the sugar and all that stuff. But if it happens, it happens, right? We all got a time and a place. But I'm going to keep making the videos, because honestly, while I'm on here talking to y'all, it relaxes me and I feel a little better. It's kind of like, I guess, therapy. Y'all may not like it. This is a 20-minute video. There is nobody still watching this video at 19 minutes and 35 seconds. Nobody. Guys, if you're having the stuff like this going on, please comment. I want to know what your issues are with your doctors. Is this a worldwide thing? Is it just a local thing? Because yes, where I live, 8 out of 10 people, or maybe not 8 out of 10, a huge percentage are meth addicts, drug addicts, so on and so forth. No, I do not consider marijuana as a drug. I personally do not use it because when I have anxiety issues, and it's always made my anxiety worse anytime I've ever tried it in my life, which has been years ago. Never tried it. But we have a huge drug problem here, and because of that, they look at every patient as a drug addict around here. My count was right. My lawyer asked me, he said, well, let me ask you this. Do you think he would have kicked you out if you went down there and you'd only took like 5 pills out of your bottle, and you had 115 pills in there and you didn't pee no oxycodone? I said, from what he's saying, this is yesterday, from what he's saying, yeah, that I got kicked out for not following doctor's orders. So technically I got punished by his math because I wasn't taking my medicine. So, I mean, let me know what's going on in your area. Are y'all seeing stuff like it? Is it this bad all over the world, the United States, or whoever watches my videos? Is it this bad that, they're sitting there telling you need surgery, and then all of a sudden they kick you out and like, you're on your own, buddy. You're on your own. The healthcare system has reverted back to the 1800s, right? You're better off. The only difference between now and the 1800s, used to you go to the store and get something to help you. Now your only choices in Alabama is alcohol. And I think, what is that stuff, CBD or whatever it is, which once again, I don't smoke. I can't stand the taste of smoke. That oil crap, I don't think it works. I think if you need something like it, you probably need the real stuff, which is illegal here. So, I don't know. Guys, long video. I'm sorry if you're still watching it, which I know nobody is. Lord, this is a long video. But welcome to the fall, right? Well, welcome to the collapse of Boss Prep and its medical escapades, right? What are we going to do? What are we going to do? We're just going to deal with it. We're not going to deal with it. We're just going to let it do what it's going to do. That's where we're at. I hope you're still watching, but I know you're not. If you are, hit that subscribe button. Stay safe. Get prepped up. Keep your head on a swivel. Be aware of your surroundings at all times. Protect yourself and your family at all times. If you have medical issues, please try to get them fixed. Just because my situation's like this may not be your situation. This is not medical advice on this video. This is my own personal stuff. Stay safe, get prepped.